Hello, my name is Dr. All, and today we're going to be talking about how ketamine changes your brain. So, ketamine has gotten a lot of attention recently as an antidepressant in the psychiatric field. It was originally synthesized roughly 50, 60 years ago as an anesthetic. They used it in surgery, then it became a tranquilizer, and then a street drug, and then finally in psychiatry, we use it for depression, anxiety, trauma, and we also use it as a psychedelic. To understand how ketamine changes your brain, you have to understand a little bit about how your brain works. So you can think of your brain as a computer with different softwares that are all playing at once. And each software is vying for attention by your brain. So you have the fear software that might be on, and that's pretty powerful, but you also have the social software that's on, and that's maybe a little bit more powerful. And all of that is combining to create your thoughts and your actions. Now, the software that is most commonly used by your brain is called the default mode network. And the default mode network is exactly what it sounds like. It's what your brain is doing when it's not really doing anything. And what your brain tends to do as a default is to rehearse situations. So it thinks about the future and what you might say in a certain situation, or it thinks about a past situation and how that went badly and how you wish that it had gone this way. People tend to think that they're the only ones that do this, but that's actually a pretty universal phenomenon. The problem with the default mode network is that when it's too powerful, it can become pathological. And that's kind of what happens in depression. So you can think of depression as a hyper-organized state of your brain. It's going through the same patterns over and over and over again. It's not able to see new things that might give the brain joy or novelty. It's just unable to see those things because it's too stuck in its patterns. What ketamine does is it disrupts the default mode network, and it does that in a handful of ways. Number one, it's increasing the amount of glutamate, which is a neurotransmitter. A neurotransmitter is a chemical that makes your brain work. So it's increasing the neurotransmitter glutamate in your brain. And glutamate is your brain's primary excitatory neurotransmitter. So it's creating an excitatory state in your brain where your brain is fully woken up. It's also increasing a hormone called BDNF. And BDNF is brain-derived neurotrophic factor. You can think of BDNF as fertilizer for your brain. So it's allowing your neurons to grow, it's allowing them to replicate and to make connections with other neurons. So when you combine this hyperexcitatory state with more growth, you increase your brain's ability to make new pathways. Another way of thinking about the brain is a series of trails or a series of pathways. And as you probably know, the more that you walk on a trail, the more dug in it gets. So that makes the trail easier to walk on, right? So if we've done the same pattern, the same habit over and over, becomes very, very easy to do that habit. What ketamine does is it allows your brain to make new pathways, to find new ways of going about your life, thinking and feeling and acting. How ketamine creates a psychedelic effect is by allowing your brain to absorb more information. So we actually only absorb maybe 1% of the information that is coming at us, and for good reason. Because if we were to absorb, let's say 50% of the information that was coming at us, we would just constantly be overwhelmed. So we tend to absorb the information that is most valuable to us. So we'll focus on food, or we'll focus on people, or we'll focus on where our car is going, things that are actually valuable to the actions that we make, the decisions that we make. And your brain's ability to filter this information out is called sensory gating. If you can decrease sensory gating, then you allow more information in, which allows you to see things that might bring your brain more novelty and more joy. This creates some of the psychedelic effects of ketamine. So if your brain is taking in more information, it might interpret that as visual hallucinations or seeing patterns on the wall. And this is a natural effect of your brain trying to process way more information than it normally does. So combined, this increased information, the excitatory state of your brain, and the growth state of your brain allow you to make new habits. Now, if you take ketamine, the antidepressant effects last roughly a month, maybe a couple of weeks. And so we like to combine it with therapy. I found that if you use ketamine and you're just sort of staring into space or you're watching TV, you're not capitalizing on the ketamine's ability to create new habits. If you combine it with something like therapy or habit change, or even reading, you can capitalize on that state to bring in new information and to make new pathways. And the effects, the meaning that you get out of the ketamine lasts much, much longer. Now, ketamine isn't for everyone. It does increase your blood pressure slightly, along with some other side effects. So people who have had strokes or cardiac disease or generally unhealthy, probably not a good fit for ketamine. But if you're generally physically healthy, but you're depressed, anxious, traumatized, it can be very, very powerful, especially when you combine it with therapy and allow yourself to have those new realizations. So to summarize, ketamine is increasing glutamate, which is increasing an excitatory state in your brain. It is increasing BDNF, which is allowing your brain to grow and to change, and it's increasing the ability for our brain to take in new information. And all of that combined helps us to process and to get through anxiety, depression, trauma, and a host of other mental illnesses. If you like this video, please subscribe below. You can also comment with any research that you found. I always love reading new research. So thank you for watching, and we'll see you next time.